Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live from the Dolph Simons Family Studio. We are back with you this morning on a beautiful Monday morning. A little bit of breeze out there and a little bit more like fall. Here, of course, with Hawkeye. And good morning. Welcome back. Hope you had a great weekend. We also have Nick Kenney, who's the head trainer for the Kansas City Royals, and Mark Logan, who leads the public health communications efforts at Comeback Kansas City. Hawkeye, how was the weekend?
It was good. You know, it's, mid-October, and the weather is still really nice.
It was nice.
Summer, yeah.
I was really not talking about you, though. I was talking about the numbers.
Yeah, the numbers are much better, although they were really good on Friday.
Yeah.
The numbers still are a lot better than they were, say, a week ago when we started, or 2 weeks ago when we started the week.
35, yes.
Yep, and now we are down to 24 in the hospital.
Okay.
But 11 of those, so almost half, are in the ICU.
Yeah, that's a big number.
And 8 of those are on the ventilator.
Yeah.
So that's a pretty high percentage.
That's a high number.
For critical illness and ventilators. We still have 25 people otherwise in the hospital who are still here, who are in that recovery status. So it's about 50 patients total, 50 beds that are being taken up because of COVID. And certainly our partners in Hayes have 17 patients. So that's down a little bit from where it was as
there
well.
There are 22, so that's a little better.
Yeah.
So things are a little better. All right. Well, sounds like the weekend was okay overall. Before we jump into our discussion, are there any reporters on the line today that have questions? All right, not hearing any. Let's start with you, Nick. Let's talk a little bit about the Royals. How did it go over the summer with COVID-19, all the special precautions in place? Hats off, because I mean, from just a spectator standpoint, you guys did great. And then how's it going to look for the offseason? And then maybe we can even talk about winter baseball and then spring training starting again. That can't come too soon. Oh, we're not hearing you, Nick. Hang on just a sec.
Things did go pretty well. It was pretty scary. A lot of anxiety early on. I think it was all because we were dealing with something we never dealt with before. But I just want to say thank you to obviously Dr. Hawkinson, Dr. Nolan, Dr. Key, and the University of Kansas healthcare system for really pitching in and helping us out through those tough times. But you know what? I think we had a good plan in place. I commend Major League Baseball for putting together a good protocol. I commend my staff for working extremely hard on it with me, and then for our players buying in as to what we were trying to do to keep them safe. Because I think it's all about social responsibility. If you don't go into a bubble type situation, you really have to bear down on the social responsibility of understanding what you're actually bringing into the workplace, and that was big for our players. Then once we got them inside, we felt like that we had a pretty good controlled environment. And of our 10 cases that we had over the course of the season, not one of them were facility related, so we're pretty happy about that.
Well, I think it also is a testament to how well all of us can do, because what you asked of the team members, or what we ask of our public every day, in trying to keep each other safe. Because I'm going to bet, even though they went home, they still got to see their family. They still kind of live, as we talk about, there's no place like home. So I suspect when they went home, they weren't in the ballpark, they were trying to be really conscious about how to keep safe.
Yeah, it's very true. We have an interesting mix, right, of players. We have got young players, and then we've got players that have families, and then we've got coaches that are older, and some of them are at risk. So it's very, very important that we do the right thing. Our young guys not going out and being in the community and putting themselves at risk. Our guys with kids, it's about being responsible in regards to how they parent and what they let their kids do and how they interact while those kids are doing those activities. And then of course, we're all trying to do the right thing so that we're not putting those that are at risk at even more risk because of our actions. So like I said, really, really happy about how everybody conducted themselves. And we're all going to make mistakes. We all understand that certainly those mistakes aren't malicious. We get that. This is a virus it's really hard to understand. It's hard to control because it's invisible and it's silent. So sometimes we don't even know that we have it, and we're bringing it in. And really, in our general population of our young players, most of them aren't experiencing any symptoms at all. So it was pretty difficult, except for the fact that we're on a very stringent testing program that was every other day. So.
So what do you tell the players as they go back home? What's the plan for them here in the off season? Which, by the way, I want next year that we're not. This is not the off season next year. Go Royals.
Gotcha. And we're certainly hopeful of that too. We think that we've got a good young mix of guys here with a lot of talent that can get us into October baseball next year as well. So we talk about pillars. Pillars are the things that keep us safe. And we talked about that those pillars follow us everywhere. There's not a protocol for the athletic training room. There's not a protocol for the weight room. There's not a protocol for the clubhouse. There's not a protocol for the food room. It's a protocol. It's not different. It follows you everywhere. Certainly, yeah, there are some very minor tweaks here and there that we go through in regards to those procedures. But if you think of it as one thing instead of 5 different things, then we feel like that your compliance goes up. So we just talk about, maintaining our pillars and carrying those with us, whether we're at home, whether we're at the gym, whether we're at the ballpark, whether we're at the field with your kid, whether you're at the airport. So, hey, mask it up, keep your distance, make sure that you're keeping your hands clean. And if you don't feel well, don't come. That's a big thing. That's something that we had to break, because we're always about, hey, if you're not feeling well, come in and we'll evaluate you and we'll tell you what we're going to do. We had to do a lot of teleconference at this point this year, and it worked out well. Not saying that we didn't make some mistakes here and there, but we certainly didn't make them twice, and we felt like that we got better each and every day.
Hawkeye, those pillars sound remarkably similar to the ones we quote, I think, almost every day.
Yeah.
The pillars of infection control go with you everywhere you go.
Yeah, absolutely. And it kind of runs off his tongue. It just is second nature. And hopefully as people do this, and now we've gotten into where it was maybe more difficult, but now it becomes second nature for people. And it hopefully that is really stopping the spread.
It does make a difference. Yeah. So how do you stay in touch with the players, Nick, during the off season? Well, what kind of how do you, are you still telling them to follow the same protocol? How do you stay reinforcing that? What are they doing? Do they go play winter ball? Give us a little sense of how's the organization taking this off season?
Well, certainly we're gonna do a lot of the things that we've done in the past. We're gonna stay in touch with these players on a rate of every 2 weeks. What we usually try to do from a medical staff is we split up our roster into fourths between myself, Kyle Turner, assistant athletic trainer, Jeff Blum, who's our head physical therapist, and Chris DeLucia, our second assistant. We'll split up the roster. We'll take our own group, and we'll make sure that we maintain contact with those players, every 2 weeks. We feel like that there's some continuity, some consistency there where guys feel comfortable, talking with us, and it helps us, create better relationships with them. But, we do it through text messaging, we do it through emailing, we do it through phone calls, and we do it through, Skype or Zoom. Our coaches do a really good job of maintaining their position groups and getting together with those players as well. And, the one thing about baseball that's different from other sports is a lot of times our players are away from us in the off season. Our off season is extremely important. We want to make sure that we're getting things done, but they're not actually in front of us all the time. So we got to do a really good job of setting the right expectation and then continuing to reinforce that expectation through our communication to make sure that they're on track. Guys that we're worried about where their situation is, we're always making sure that we're bringing them in periodically to check on them, to give them updates and get them on their way again. But, we're going to do a lot of those same things. I think that, last year gyms were closed down. Hopefully the spread will stay at a level where those activities can happen and people can maintain their fitness levels. But the thing is, where we got a leg up is that our guys found a way to stay physically fit without actually having to go into a gym. And we equip them with the right materials to be able to do that again if we're in that same situation going into 2021. Let's hope that it doesn't happen that way. But one of my favorite quotes is that, hoping gets you behind. And the reason why I say that is if you hope that it's going to be better tomorrow and it's not better tomorrow, and then you hope that it's going to get better again, now you're 2 days behind of actually doing anything because all you did was hope. So prepare yourself, keep moving forward.
Yeah, I like that. That's good work. And you guys have been super involved in some flu shots. Talk to us a little bit about that.
We have. So we made flu shots available to all of our players, staff members there at the end of the season. I think it's important that we've always done that, but obviously going into this off season, we thought it was even more important because there is a chance that you're going to have to deal with both of these at the same time. You're going to have to deal with COVID and flu at the same time. So we've always made it our main objective to promote health. And this was just another way to say, hey, guys, we appreciate you. We care about you. Here's something that's available to you. We recommend it. And we had a pretty good turnout on it, too.
That's awesome. Hawk, you and I got ours right here on the air last week. So, Mark Logan, can we talk a little bit about Comeback KC? Tell us a little bit about how or what Comeback KC does and your role there, and then also how you're working on flu shots as well, which Dana and I are we're so happy about. Thank you.
Yeah.
You bet. So Comeback KC is kind of a unique organization where this mishmash, this public-private partnership, supported by corporate partners, organizations like the Greater Kansas City Chamber, KCADC, the Civic Council, working really closely with public health professionals from around the region. And our goal really is to help accelerate Kansas City's comeback from COVID-19. You know, we do envision a time, don't know when that's going to be, but we envision a time when all of this is more or less in the rear view, right? We've solved it, if you will. We have a vaccine, or we've settled into a new normal. And so we're working to accelerate that time. And we do that through supporting public health strategies and through communications.
So flu drive, though, you guys have picked out as a big drive, or a big effort. So thanks for that. Talk to us a little bit about your efforts around the flu shots.
You bet. Well, you know, as you guys know, this year getting a flu shot is more important than ever. We've been hearing for several months from the public health professionals in the region that they're very concerned about a twindemic, if you will, of flu and COVID at the same time this fall and winter. So they asked us to do what we could to encourage everybody in the region to get a flu shot this year. We reached out to the Royals, and they've just been an incredible partner to work with. They helped us earlier this summer with a PSA encouraging mask wearing, and helped us again this fall with a PSA for flu shots. We really want everybody in the region to get a flu shot this year, even if you don't normally get it. You know, this year it's more important than ever because we really need to minimize the burden on our testing labs, our healthcare systems, and our frontline workers. So that's just it. We're encouraging everybody in Kansas City to get a flu shot.
Yeah, we're right there with you. And I also think it's wonderful that you guys coordinated your blue shirts this morning. Well done. Good color scheme. And Hawk and I are right there with you.
Yeah.
Let's go
absolutely.
Royals. All right, Jill, let's see what questions are out there from the community this morning.
All right, Betsy wants to know, what are your recommendations on eating at restaurants whenever the weather turns colder?
Mm-hmm. Yeah.
Well, I think that's hard, Hawk. I have not been into a lot of restaurants yet. I've been a couple of times. Do try to sit outside as the weather gets colder. I know a lot of restaurateurs are trying to do the tent thing or some kind of covering with the heaters around. I think that's a good deal. But the simple fact is, when you go inside, the ventilation's not the same. The virus hangs in the air. All of a sudden, those new CDC things about aerosol and droplet take more and more effect. I'm a little concerned about that.
I would certainly be more concerned. I think if you go on a night that is not as busy and maybe there's one or two other parties in a restaurant, but certainly on a busy night, going into those enclosed spaces, just as you talked about, whether it's the actual building or the other tents that are put up, I think your risk is certainly higher than in the summer when you can eat outside.
Yeah, so I think it's going to be more difficult, and I would just say I know that's going to be hard on restaurants.
Yeah,
and
which we don't like.
I know I try to do the takeout regularly, so love a lot of good places here in Kansas City, and so I think that's going to be hard on restaurants though, unless there are ways to effectively lengthen the time you're going to have dinner or lunch, and try to roll through when there's fewer crowds in that room. And it's not just the 6-foot thing at that point. The problem is a lot of the places I've seen measure 6 feet from the middle of the table to another table, and that means backs are still 4 feet or 3 feet together. And I think when you put a lot of people in a crowded room, or even what we wouldn't think of as crowded historically, but now we do, I think we have to be super cautious around that.
Yeah, I agree. Just an increased level of caution. We want our restaurants and our businesses to stay open, and our servers to work, and our cooks to work, and everybody who's associated with that business. But it is just just a little bit more risky, unfortunately.
Yeah, and I think the amount of virus that's in the air, as we know, our breath clouds are out there, and as the weather turns colder, you'll be able to see your breath cloud and get a really good sense of it. But I think what you have to remember is that once you get into a restaurant, it's not time to take off your mask. I think people have kind of thought, well, I'm in a restaurant, I take off my mask.
I'm sitting down, yeah.
No. Your mask stays on until you're actually eating the food, and then you put your mask right back on. Yeah. That's the right way to do that, because otherwise it's just dangerous. So I think we just have to be cognizant and keep those pillars we talked about earlier, they're still there.
Renee says that Dr. Lee Norman said last week at a news conference that we were losing the battle against COVID in Kansas. She sees that hospitals in other states are being overwhelmed. Is it inevitable that we're going to be overwhelmed?
I don't think the word is inevitable. I think it's hard work to not be overwhelmed. And the hard work occurs every day, and it occurs because we're willing to make the sacrifices to follow those pillars of infection control we constantly talk about. And whether that's washing your hands, keeping your distance, wearing your mask, staying home when you're sick, and doing the things that help keep our community safe, we will then also make sure that helps keep our state safe and our region safe. And when we don't follow those pillars, things get out of control. And that's what happened in Hays when our hospital there, HaysMed, had a lot more COVID patients in it. I think we can win the battle, but the first battle we have to solve is the one within. It's the battle inside ourselves to try and not to think that we don't have to follow the rules of infection control. And it's the same battle that we had to fight in 1918 and 1919 with the flu pandemic. It's the same battle we would fight any other time, Hawk. But that battle within, to try and convince ourselves, gosh, we really got to follow those rules, we know that can work.
Yeah, absolutely. And it's hard to do, especially, again, as we are getting into colder weather. Everybody has been enduring this. It is not being able to see friends and loved ones. It's not being able, invited to a birthday party that I can't attend because I can't go to these group gatherings because we know that's when those events take place, or it's Halloween parties that are coming up. Those events, when you have large amounts of people indoors, we know that is when it is more dangerous and the virus can spread. And you individually may be okay and low risk, but can you spread it to other people who are high risk? And not only that, even if you are low risk, you can still feel bad and be sick and be out of work. And if that happens to a lot of people, again, whether it's a business, supply chain, it's the people that deliver our goods every day, that decreases the workforce. And we saw that happen with the pork processing plants as well. So,
Nick, I think it's a great, just to talk a bit about this again, I think it is a success story. Because baseball had the same challenge, right? You guys were able to have people follow those pillars and still play the games. I think it's remarkable. Early there were some problems for the Cardinals or the Marlins or whatever, but man, it was humming by the end of the season and people had gotten it down.
Yeah, you know what? It's all about being more comfortable with the process. It's like it becomes old hat. And I think you guys are making a good point. As we get deeper into this pandemic, the longer it takes, instead of getting tired of it and pitching all the pillars to the side, we've been doing it for a while. Let's keep doing it, and let's strive for our goal to get over it. For us, the games were the ultimate prize, and then it was the next game. That's what we talked about here was, hey, when we started summer camp, we've got to get through our first practice, and then we got to get through our first week of practice, and then let's get to our first week of games, So you got to set these little goals for ourselves, and then it was, let's get through the first month, and then the second month, and let's get to the playoffs. It's a team effort. It's a lifestyle modification, and those take time, but it also takes reinforcement each and every day to get it. And people have to feel comfortable telling people when they're doing something wrong. And believe me, I didn't feel very good about myself because I felt like that all I was ever doing was just complaining to somebody about what they need to do here, what they need to do there. But if you're going to be that person that's going to tell people what to do, you better be willing to do it yourself. And that was the thing that we had here was all of our staff members were bought in, worked extremely hard to create an environment for these guys each and every day. And then, out of respect, our players just really started to do what we asked them to do. And That's what it takes. It's diligence. Just bearing down each and every day.
Mark, it's got to be true because, I mean, you got to be working with restaurant groups and people like that who are worried about what's going to happen as the weather gets colder. Talk to us about some of the efforts that are going on there.
Yeah, for sure. I think, as you said earlier, everyone wants our businesses to be open, and we want the economy to be thriving. Restaurants are worried about the onset of winter. I think we've seen a lot of adaptability and creativity. For me personally, we're trying to support our local restaurants as best we can through takeout. I'm just not comfortable dining in, given what we've heard about aerosols. So we're trying to keep our local restaurants supported and thriving through buying as much takeout as we can.
Yeah, I got wings from the Peanut this weekend, and
Yeah,
it
there
was
you
great.
go. They do have good wings at the Peanut.
Stacy wants to know, do you understand or have any idea why the COVID-19 rate dropped almost half in Johnson County, allowing kids to go back to school?
Hawk, do you know that?
Yeah.
Talk to us a little bit about that.
Yeah, I don't exactly remember exactly how they changed the rate to decrease or change the gating criteria to go back to school. We can certainly look into that.
Yeah, I don't remember the
off the
specific
top
date
of
of
my
time.
head.
I know
Yep.
that the numbers, that the rate had dropped a little, and then they felt like it was good to go back. But I also think that Johnson County made a decision that they needed kids back in school for mental health and other reasons. So let us work on that a little bit and come back.
Okay, great, fair enough. Matt has a similar kind of question with obesity versus overweight. The CDC did say that if you were obese, you were at a greater risk of getting sick, and then they recently changed that to if you're overweight. What's the difference?
Yeah, it's really just a matter of degree.
Yeah.
Overweight is a certain weight classification about how far you are over your ideal body weight, and then another level once you hit obesity. And you can go out and look on the internet and run the BMI calculator, and they'll tell you if you land in overweight or obesity. But being overweight is a stress on your body, and so as a result, things like COVID-19 or SARS-CoV-2, the novel coronavirus, when you get ill, all those stresses in your body count, just like if you have a history of chronic obstructive lung disease from smoking, or if you have high blood pressure and kidney disease. All those things add up and make your body more susceptible to infections of any sort. And you could easily have a harder time in influenza. You have a harder time with asthma. You have a harder time with lots of things when you're overweight. And the same thing is true with SARS-CoV-2, Hawk.
Yeah, absolutely. It's all a continuum. So it's a BMI of 29 versus 30, or 34 versus 35, depending on how you're determining obesity. But it is all on that continuum. That overweight and obesity is a stressful condition on your body in the molecular aspects, with inflammatory markers and things of that nature that are going on within your body at the cellular level and molecular level as well.
All right, Anonymous writes, I have suffered from anxiety since the beginning of the pandemic. I am treating the anxiety, but still have more fear of the virus than most others around me. Is there any reassurance that you can give someone who follows the pillars but ends up getting COVID anyway?
Yeah, so hopefully you haven't had COVID, but the anxiety is real for a lot of people, and I know it scares us because COVID can get you in many different ways. What I can tell you, and Nick made an important point earlier, that you can't live on hope. You have to follow the pillars on a regular daily basis. And I think that's really true, certainly with what we preach here in the health system. And we keep our employees safe and the staff safe for actually taking care of COVID-19 patients. So the pillars really do work. I mean, they really do work. I think the long run is that there are some drugs that are going to help this a lot. Both the vaccine, which hopefully will be launched after the first of the year or soon thereafter, and then also these monoclonal antibody therapies, the ones both from Regeneron and Eli Lilly that already have gone in for the early use authorization, Hawk.
Yeah.
I think those are going to be game changers. And the data around that I'm reading looks pretty strong.
Yeah, and certainly it's going to not be one thing, just as you said, the vaccine plus therapeutics, whether it's the monoclonal antibodies or the convalescent plasma as we get further into this. We are already creating systems here at the health system so that people can get those once the EUA is established. There are a lot of logistic and technical factors, but we are working on that currently. But also, again, we talked about the vaccines, monoclonal antibodies. the direct antiviral agents, something other than remdesivir that can, optimally be given like a pill like we do with Tamiflu. So it's all of these things. But even before you get to that point, it's those preventive measures that you take. And it is difficult, and we do absolutely understand your anxiety, but doing all of those things will reduce your risk as much as you can. Nothing is reducing the risk to zero, really, unless you're just staying inside your home. And
shelter at home.
that's anxiety-inducing as well. So it is a very difficult and real thing that our viewer has asked about. But doing those things moving forward can certainly help you.
Yeah, I think it makes a huge difference. And remember that if you do the right things and you stay healthy and you work at it, the overall mortality rate is still low. We think that the case fatality rate probably runs, which means of all the people who got the disease, how many people really die? It's still probably 1 in 200 or something like that. So that's still higher than most diseases, however, let's be clear. But I think that if we follow these pillars now, we start getting vaccination monoclonal antibodies after the first year, late winter, early spring, I'm hoping there will be some fans in the stands at Royal Stadium for opening day. And I think by the time that we get back to the All-Star break, that, man, we'll really be in a lot better shape because of vaccination and monoclonal antibodies. And at that point, it's going to be batter up, let's go. And I think that's how we have to look at it. I do think that there is hope on the horizon. I think as we get through this winter and the flu and cold season, I think we're going to be a lot better off after that.
Sarah wants to know, is it safe to be around someone in your home who has COVID after the 10 days? And also, how does that work with the 14 days I'm supposed to quarantine?
All right, this is a good question. It can sound so darn confusing because we tell people if you've got the infection, really it's 10 days after that you're likely going to be shutting the virus, and at that point you can kind of get back out a little bit. But if you've been in contact with it, it's 14 days, not 10. But that in part gives you 4 days to start getting the symptoms. So you really have to give it a few days to incubate.
Yeah, absolutely. Yeah, so you really should be okay after that 10 days from diagnosis or 10 days from symptom onset. That's based on what we know about how the virus, the natural history of the virus in your body and the immune system, the ability for the immune system to catch up to the virus to really decrease the active replication of infectious viral particles. So really after that 10 days,
10 days, no fever, and marked improvement in symptoms.
Correct. Yep. From symptom onset or diagnosis, you should be able to get back in society and be around that person. Now, if you still want to practice distancing as much as possible, possibly even masking in the household, those things are all good things to do as well. And unfortunately, with the quarantine issue, the 14 days, that does cause a lot of consternation in people, and it is difficult to understand 10 versus 14 days. But we know that still at 12 days, you can develop symptoms even if you had exposure, 12 days prior to that. So that's really the issue. But you should be able to get back into communication and interaction with that person. But you can also do those other things about distancing and masking as well.
Yeah, good questions, though. Okay.
Yeah, Jamie also asks, when should a person positive with COVID-19 go to the hospital?
Also a good question.
Yeah.
Hey, one thing we didn't say in that last caller's question that I want to follow up for just a moment, the risk of actual household spread amongst, if one person's got COVID-19 in the house and the rest of folks don't, what's that risk of spread, Hawk? Is this not 100%?
It's not. From the best articles, the published studies, really ranges from 5 to 30%. For the most part, the best weighted studies, probably about 15 to 20% secondary attack rate within the household itself. So
that's pretty darn good, really. And it says that and the more you wear the mask and the more you try to stay distant in that house, just because one person's sick doesn't mean that everybody's going to get sick. And I think that we have to be thoughtful around that. And Nick, that's kind of like what happened with the Royals. A couple of guys get it, but not everybody gets it because you guys have good infection control measures.
Yeah. So the times that we ran into some problems, it was because guys were together and, obviously one person spread it to two more. But we were able to jump in there and do contact tracing. Which I think is extremely, extremely important. We have a great contact trace team here at the Royals, and we were able to limit the exposures based on who was attached to who, and separate them. So it's really important. Like I said, it's really important that once you establish where the start is to squash the start and separate. And I felt like that we did a pretty good job of that.
Okay. And Mark, a super spreader event, that's got to be the business community's worst nightmare. That could close a business forever. So they got to be wanting to see people do the right thing here.
Yeah, absolutely. I think the business community, as much as anybody wants to see this thing contained and controlled and ultimately vanquished, the key to that is this test, trace, and contain strategy. We need to be testing at widespread levels. Unfortunately, we're not seeing a sufficient level of public testing in the greater Kansas City community. People need to participate with contact tracing. If you get that call from your public health department contact tracing team, answer it, work with them. There are a lot of fears out in the community about what does contact tracing mean? Does the government have my information? The real truth is that health department contact tracers will not share your information except in the interest of public health to make sure that people get separated and go into quarantine or self-isolation as needed. So that's really, from a public health perspective, that's the heart of the strategy. That's the way that we as a region, as a community, can get this virus under control. More testing and participation with contact tracing. That's the key.
All right. Now let's go back to that question you asked that I didn't answer.
About going to the hospital. When should you go when you're sick?
Really, Hawk, I think it's a couple of things. First, if you start getting short of breath, and I think that's a real time to get in. Here's why. You don't want to delay getting to the hospital because there is therapy that makes a difference now. Right now, it's not for every outpatient. Once we get some monoclonal antibodies ready, I think that's a different question. But for right now, you want to get there once you start getting short of breath, because then we can start putting you on therapies like Lovenox, Decadron, Remdesivir, convalescent plasma, and the things we know make a difference. So if you start getting short of breath, if you start feeling so fatigued that you're having a hard time moving around, if you have any sense of heart palpitations or chest discomfort or chest tightness, or if you're getting dizzy and lightheaded, those are the kind of things you're going to say, I'm not doing well enough here at home. I need extra help.
Yep. Know your body. Know what your symptoms are, what you're feeling. The natural history of this virus infection tends to be within that first 3, 4, 5, 6 days, you can feel really bad. High fevers, bad muscle aches, headache, obviously loss of smell, maybe some cough. But some people don't have that. Some people come to the hospital just because they're feeling bad enough, just aching and high fevers. But then you get into that 10, 12, 14-day mark, and that's when you start to have really that immune dysregulation. You have your immune system catching up with the viral replication, going into overdrive. You hear about that cytokine storm and that ARDS, that respiratory failure. So it's really two different stages. And even in those early stages, you can just feel horrible. I've seen patients on the floor who come in, they don't have cough or shortness of breath, they just feel horrible with bad fevers, bad aches. They then go home a few days later when that resolves. But then you got to look for that second stage. So it really depends on how far are you from onset of symptoms. Where are you on that course? Are you within that first week or so, or are you into that second week? So it is different, but understand, are you having really more shortness of breath later on? Is it harder to breathe? Just as you said, chest problems, issues like that. Any time that you really feel that at home you are not getting any better, you are getting worse, then it's time to come into the hospital for sure.
I think that's right, because again, there are some therapies that can help make a difference, and you don't want to delay for too long. You also don't want to be here too soon, because gosh, who really wants to be in the hospital after all? It's not the best place.
Amanda wants to know about children and the COVID vaccine. Will there be one for them? And if yes, do you think they ought to get it and make it mandatory, kind of like with flu?
Yeah, that's a great question. I think right now most of the study emphasis has been on the adults and those aged 18 and over. So until we have more data in kids, I'm not sure that we can say every kid should go get the vaccine data.
Yeah, I mean, I can reliably envision that certainly there will be recommendations for pediatric vaccination, but right now there isn't a large push to study that population, just because we know, thank the Lord, that children, for the most part, a vast, vast majority of them do fine with this. a very, very, very small percentage have that multi-system inflammatory syndrome, so it is very small. I think eventually, yeah, there probably will be a vaccine for children, but right now, again, the big push is more towards that adult population.
Yeah, I think that's right, and I think eventually will be. Now, the question about mandatory vaccination is a different one. I think, and especially in the United States at least, that people are going to want to be able to make some of their own judgments because you want to see how safe the vaccination is. And until we see the data, I don't think we're going to be able to say whether or not it's going to be a requirement. We don't know its level of effectiveness yet. We don't know the safety. I think we're going to be okay on both of those, but I expect that there will be some what we call the post-marketing surveillance. That is, after something's released, then we see how people are doing on it, and that will be able to admit, and we're going to need to know that information before we make it, before we can make it mandatory.
Yeah, absolutely, and it's just going to be one step. And who knows? Is it going to be in this first generation? I suspect there's probably going to be 2 or 3 different new generations of vaccines as we get better technology, learn more about the virus and things of that nature.
There's just so many vaccines right now. We don't even know which one to make mandatory.
That's right.
So.
All right, Diana and Lindsay have 2 separate questions, but it's all about travel and probably around the holidays. Diana says she's going to be driving to Chicago at Christmas time. She's going to quarantine 10 to 14 days before going, but she's afraid of the rest stops.
Okay, so this will probably wrap our day up with all these questions because this is a big one. Travel is a big part for all our lives, and I'm going to be curious to see what our guests are thinking about how they're going to handle their holidays as well, whether it's Thanksgiving or Christmas. And I think the bottom line is the same thing you hear us say all the time. The rules of infection control travel with you wherever you go. In addition to those rules, especially when you're from Kansas and Missouri, you better check your destination and see what the requirements are. Because we have such a high rate per capita that some states are reluctant to let people from Kansas and Missouri come into those states without them quarantining once they get into the state for 14 days. I wanted to go see my daughter in Chicago this last summer, and I couldn't do it without having to quarantine for 14 days once I got to Illinois. They didn't care what I did here while I was here in Missouri and Kansas. They cared that once I got to Illinois, I had to quarantine for 14 days. So make sure you know what are the rules for public health once you arrive there, and you can get those by Googling it online. But then the second thing is going to a rest stop is really no different than going to a grocery store. As long as you get your mask on, you maintain your distance, you wash your hands, and you may have to sit there and wait for the crowd to disperse before you go in. But I've done some traveling this summer back and forth to Colorado and to southern Missouri, and I'll just tell you, you can stay safe as long as you follow the rules of infection control, Hawk.
Yeah, you can absolutely do that at the rest stops or the gas stations. It's certainly feasible. I think the important thing to know is certainly quarantining 10 or 14 days before you make your travel so that you are making sure you reduce your risk where you're at as much as possible for exposure, and then you can travel to see your loved ones or possibly any other vulnerable populations. And once you're doing that, continue to do the things we've talked about, distancing as much as possible, whether you're going into a rest stop or anything of that nature, masking, certainly eye protection and goggles when you're going into those places as well, especially if you're flying on a plane. Those are all things that you can do to make it as safe as possible.
Nick, what are you all doing for your family over Thanksgiving and Christmas? How's that going to look for you?
Great question. So I'm in a situation where my mother and my sister are immunocompromised. Both of them are in the process of recovering from cancer. So we've got to be really careful in regards to going back to Ohio. Our plan is to go back to Ohio. I've made a huge sacrifice by not spending time with family members over the course of the last 5 months because of the season and my situation and their situation. But our plan is we're going to get in the car and we're going to drive to Ohio, and we're going to keep our gatherings very small. We're certainly going to pay attention to our actions prior to leaving, and then, maintain our pillars the whole entire time going there. And once we get there, so that I can see my mom and my sister.
Well, good luck and Godspeed and good recovery, I hope, for your sister and your mom. Those are real things that we have to deal with in the midst of a pandemic. Mark, how about you?
Yeah, I think we're in the same boat as Nick. We're just going to keep it really small. I think it's important for people to remember that even though you might just be with family and a close circle of people you trust, doesn't mean that everybody is safe. We've seen a couple of family reunions here in the metro area this summer turn into spreading events. So those pillars of infection control that you guys keep mentioning, those really have to guide the behavior, and think about alternate ways to celebrate the holidays this year. That's what it's going to come down to for a lot of people.
Hawk?
Yeah, I mean, I think Nick just made so many good points today. You can't continue to hope, but do those things that we've talked about, because it is a lifestyle change. And when you do those lifestyle changes, it does become second nature. And what is that lifestyle change? It's those pillars of infection control we've been talking about. Stay separated as much as possible. Wear your mask when you go out in public. Do the hand hygiene. Don't go out if you're ill. So I think, really Nick said it best this whole show.
Yeah, I think, we usually have 30 or more people with our Thanksgiving thing, a lot of friends and family and any strays out there didn't have a place to go to. And this year, I think it's just going to be, our core family and a very small bubble, the bubble that's been together, plus my daughter coming down from Chicago. And I think when you do that, we all recognize that we're going to open up our bubble just a little bit, and we all accept that risk. And that's what this whole thing is, right? You try to mitigate as much of the risk as you can to try and stay safe, because there's effective therapy coming out. And on the other side of this, it's going to be, as we said a little while ago, batter up, let's go. But to get there, you have to work hard at it in the meantime, not just hoping you're staying safe, to Nick's point earlier and Mark's point, but rather to say we're going to work to stay safe. So Mark, final thoughts today, working with the business community to keep folks safe.
Well, it is just about those pillars of infection control, that lifestyle change. I will say we have a really exciting tool coming out. We're partnering with an organization called COVID Can I Do It? That lets people assess the risk of various activities. You just said it's all about, knowing the risks, making those calculated risks, but trying to keep as safe as possible. This is something that's going to help people understand what factors create those risks and how to avoid the situations that are most risky.
Nick and Mark, thank you. Nick, final thoughts today?
You know what? I just want to say to everybody, stay safe, stay healthy, control what you can control, which is your attitude and your preparation, really. Take advantage of what you have, be grateful for it, instead of being anxious about what could happen. Take advantage of what you can control it well, and make sure that you're telling other people to do the same thing. I mentioned this when we were on here probably 3 months ago. I said, it's all about you can't get into a situation where you're not living to not die. Let's go out there and let's live our lives, but let's make sure that we're being responsible to each other so that we can go out and enjoy ourselves as much as we can in the midst of a pandemic. So, Godspeed.
Well, I think that's just totally true. Hawk, final thoughts?
Yeah, absolutely. I mean, again, so many good thoughts today and points today. I would absolutely agree with that. It's still nice for the next few days, so certainly if you are going out, make sure you're trying to do that outdoors on a patio. And let's hope moving forward into the colder season that everybody gets their influenza vaccine and otherwise has that individual responsibility to stay healthy.
Yeah, that wind was blowing around yesterday, so there was no breath clouds sitting still outside yesterday.
It was nice.
Hey, folks, we got some pretty cool photos here that we keep talking about. And remember to send us your mask pictures. We're looking forward to see how you're going to use your mask with your Halloween costume this year. We hear from 2 COVID-19 survivors tomorrow, one in nursing school and another a seasoned nurse. Both caught COVID-19 in the community. 21-year-old Mara joins us in the studio as she still struggles with fatigue and other symptoms. 58-year-old Lynn joins us after 64 days in the hospital, 45 of those on a ventilator, 14 days in rehab. Remember to get your flu shot. We've talked a lot about what tomorrow's going to look like. And I made a comment, and Nick and Mark were talking about that balance between you got to live your life and stay safe. It is different, and it is hard. And I got to believe that yesterday had Arrowhead Stadium been filled, the Chiefs would have had even more energy and vanquished the Raiders. But you know what? There'll be a tomorrow to live for. There's going to be another football game. The Royals will be back next summer. The boys in blue can't wait to be out at the stadium saying, "Let's go Royals." And then last night, Sporting, what a nice win with that amazing goal from far out of the box. So you sit there and you think, hey, there's still cool stuff going on, right? How many more things is Patrick Mahomes going to do out there, right? How many more times are we going to be able to watch the Royals lift that world championship? And Sporting, there's just good stuff going on. And how about the Tigers beating LSU this weekend, huh?
I mean,
that was amazing.
I don't want to talk
so
about
I'm
that.
just saying there's still good things going on, and we can still be in touch, and we can still hang in there while we fight through the pandemic so that we can have that tomorrow that we all want to have, because effective therapy, it is on the way. So until we see you tomorrow, remember, stay safe out there. Follow the rules of infection control. There's still no place like home. Thanks. We'll be back with you tomorrow.
It's time to get your flu shot. Put on your game face, gear up, protect yourself and your community against the flu.
This year, more than ever, getting a flu shot matters.
Protect yourself, your family, and your community.
Flu season will be here fast. The best time to get your flu shot is now. Getting a flu shot will not protect you from COVID-19.
But people who get the flu may be more susceptible to a severe case of COVID-19.
By getting your flu shot, you can ease the burden on our labs, our hospitals, and our healthcare workers.
And a flu shot means you reduce your risk for symptoms, severe illness, and being hospitalized.
Get your flu shot and maintain the pillars of infection prevention to stop the spread of flu and COVID-19. Wear a mask, maintain social distancing, and wash your hands frequently.
You heard the doc. Do your part. Let's go, Royals fans. Get your flu shot.